Nowhere in academia do you see more of a need for active learning than in health IT, in my opinion. Because there is this confluence of two different areas intersecting in healthcare and IT. There has to be an active process and reaching out into the real world and gaining an understanding that you can't appreciate in the books. Sending students out in the field is essential, and what the manner with which this program is doing it is unique. It's unseen in most other health IT programs in the state and across the United States. And I think that's one of the large reasons why this program is considered one of the leaders in the country in health IT education.
The 2-week practicum was also an attraction for me because I thought I'm not just going to leave having just done an academic program. I'm actually going to be able to go into a setting, I'll be meeting people in the field, have a chance to test before I'm expected to go out on my own.
I got to see all of the issues that arise with doctors' offices when they switch to EHRs and when they want to upgrade and do all of that stuff, and what hardware you need and what software you need and all of the things that go into having an electronic health record system. And through that, through Vitera, I also got to see what the client relations part would be, the customer service side.
I got to not only work with the content development team that was developing material for the new product that they're going to launch, but I also got to work very closely with the CEO and with various directors that gave me advice on my own career path, as well as information necessary to figure out whether or not I would be a good fit at that particular company.
It introduced me to the different realms of work that they have there that I could possibly become part of. So I actually got to work with people who were doing the job that I hope to do in the future. So I got to kind of see the culture of the company, and I got to see how they felt being in this career and if they liked it or what they didn't like about it. So it was nice to have one-on-one time with people who are actually in the field that I desired to be in.
Understanding all the little pieces that are involved behind the scenes, that was a good experience, seeing that at the practicum at UT Southwestern that I was a part of.
I had the opportunity to have exposure to the different types of career opportunities by working directly at a site. And so I worked at an EMR vendor here in town for 2 weeks and got the opportunity to see if I moved into a project management role, what might that look like, versus if I moved into a sales account management role, what would that look like? And also, just as importantly, is what are realistic expectations with regard to where to enter. With someone with the background that I had, as opposed to an entry-level position, I wanted to make sure that it was an appropriate opportunity to move in the right area.
Placed me in the product management department. I had no idea what product management even was before then, so I actually had to Google that and figure it out. But it turned out to be a perfect match for me. I was really excited, and I got projects to work on. We got to sit in with the new hires and do some of their training. They really took advantage of us being there, and we really took advantage of the opportunity. We were also allowed to float around to the different departments, so they were really willing to let us learn everything we could about the company before we left.
The practicum was really a good experience for me. That's where I learned the most, I feel like, because I got to interact with lots of different people and got to see how each job interacted with each other and got to see exactly what they do on a day-to-day basis.
Really, it all came together for me with the practicum. So that's really where I put meaningful use together with public health, with HIEs, with vendors and EMRs. So when I'm sitting across the table with an interviewer, I'm definitely very confident in what I'm talking about with reference to, meaningful use, public health, legislation, business aspects as well.